Unfolding the major cause of phlegmy. Constant phlegm in the throat, also known as mucus, can be caused by factors. The major of a constant phlegmy throat are typically related to conditions such as allergies, nasal drip, and respiratory infections. We would look at the causes, symptoms and the treatment for phlegmy more than just an unpleasant nuisance. Mucus that collects in your airways can make breathing more difficult and increase your risk of infection, which can further damage your lungs. Living with a chronic lung disease means you are likely experiencing an excess of this thick and sticky fluid in your lungs. It's important to note that other factors like acid reflux, gastroesophageal reflux disease, GERD, and low stomach acid levels have also been associated with chronic phlegm in some cases. Acid reflux occurs when stomach acid flows back into the esophagus and irritates it, leading to an increase in mucus production. Symptoms of GERD are heartburn, regurgitation, excess mucus, throat irritation, lump in throat, postnasal drip, gets worse and laying down. Another condition is called laryngopharyngeal refer, LPR. With the LPR, the acid come up higher into the vocal cords and back of the throat. Postnasal drip. This occurs when excess mucus produced by the sinuses accumulates in the back of the throat and can be caused by allergies, sinusitis, or colds. Treatments may include nasal saline irrigation or sprays to help clear mucus from the nasal passages, antihistamines to reduce allergic reactions, decongestants to alleviate nasal congestion and decrease mucus production, corticosteroid nasal sprays to reduce inflammation in the nasal passages. Allergies. Allergic reactions to environmental triggers like pollen, dust, mold, or pet dander can lead to increased mucus production. Treatment options may include avoiding allergens whenever possible, antihistamines to reduce allergic symptoms, nasal corticosteroid sprays to decrease inflammation and mucus production, allergy shots, immunotherapy, for long-term management of allergies. Viral or bacterial infections such as the common cold, flu, sinusitis, or bronchitis can cause excessive mucus production. Treatments may include rest and hydration to support the immune system, over-the-counter medications like decongestants and pain relievers, antiviral medications, for flu, or antibiotics, for bacterial infections, if prescribed by a doctor, steam inhalation or humidifiers to soothe the throat and loosen mucus. In addition to these treatments, general lifestyle measures can help alleviate symptoms of a phlegmy throat, such as staying hydrated, avoiding smoke and other irritants, using a humidifier, and practicing good vocal hygiene. To address a constant phlegmy throat, it is recommended to identify and manage any underlying causes. For allergies, avoiding triggers whenever possible and using antihistamines or nasal sprays prescribed by a medical professional may help alleviate symptoms. For postnasal drip, staying hydrated, using saline nasal rinses or sprays, and irritants like smoke or strong odors may provide relief. For respiratory, resting, staying hydrated, and using over-the-counter remedies to relieve symptoms can help manage the condition. If you are experiencing persistent or bothersome symptoms, it is advisable to consult with a medical professional for an accurate diagnosis and appropriate treatment. Sure. Here are some additional notes on dealing with a phlegmy throat. Stay hydrated. Drink plenty of water throughout the day to help thin out mucus and keep your throat moist. Warm liquids like herbal teas or broths can be soothing. Gargle with salt water. Gargling with warm salt water can help reduce throat inflammation and loosen mucus, providing relief from discomfort. Use a humidifier. Adding moisture to the air with a humidifier can help soothe a dry or irritated throat, making it easier to cough up mucus. Avoid irritants. Stay away from smoke, strong chemicals, and other irritants that can exacerbate throat irritation and increase mucus production. Practice good vocal hygiene. If your job or hobbies involve a lot of talking or singing, Be mindful of vocal strain. Rest your voice when needed and avoid yelling or whispering, as both can strain the vocal cords and worsen throat irritation. Elevate your head. Sleeping with your head elevated can help prevent mucus from pooling in your throat overnight, reducing morning congestion. Consider dietary changes. Some people find that dairy products, spicy foods, or foods high in sugar can exacerbate mucus production or throat irritation. Pay attention to how your diet affects your symptoms and consider making adjustments if needed. Remember that everyone's body reacts differently, so it may take some trial and error to find the best combination of remedies for your specific situation. Seek medical attention if necessary. If you experience persistent or severe throat congestion, difficulty breathing, fever, or other concerning symptoms, it's important to see a healthcare professional for proper evaluation and treatment.